Happy Friday, everyone across Ontario and Canada. Welcome to PSW Podcast, where we go live every single Friday, right around 11 a.m., to talk about issues pertaining to personal support workers across our nation, and of course, very much here in Ontario. My name is Miranda Romanowicz. I'm the CEO of the Ontario PSW Association, host of PSW Podcast, and I'm joined by my co-host,
Oh,
Mr. Ian DaSilva. We're both battling coughs, so bear with us through this PSW podcast. Ian is the Chief Operating Officer of both the Ontario PSW Association and the Canadian Support Workers Association. And we are here today, pardon me, to talk about the fact that we have coughs, number one, everyone's sick, but also two, to talk about the Ontario Personal Support Worker post-COVID, Wounded in Chaos. This is the paper that Ian has worked very diligently on since before Christmas,
yes.
compiling data and statistics of WSIB claims from personal support workers from 2020 to 2024. We had done a similar paper to this, Ian did back in 2017, 2018, and it had a really big impact, and it really shows the reality of working as a personal support worker in Ontario, and that's where our main focus is today. And Ian, I
Okay.
guess take it away. Yeah.
So the paper is broken down into two sections, really. It's really the first section is trying to figure out what is the PSW in Canada? How does the Canadian government, provincial government, what do they call you guys, the PSWs? Like, what are you called? Because when you're looking at federal data and provincial data and educational data and injury data, each one of you is called completely something and tracked as something different in each of those categories. So just not to bore you, but the first part of it goes into the industry classifications, how Canada uses it too, both in that international and a national classification system. Within that classification system, we use sub-classification systems, but those classification systems don't align with the provincial classification systems, which are used to track health and injuries. So what you end up with is an incredibly chaotic mixture of pathways to try to track what is and how do we find out what the PSW does. Now, despite the convoluted nature of all that and the 70 to 200 titles across Canada, in Ontario, for example, they are tracked as PSWs when you're looking at post-education. So then the next part of the paper discusses the educational landscape, the roles of the different sectors in education. But it's the bottom part of it that looks at, since COVID, the injuries. And Miranda, I think that's really what we want to focus on. So just for the benefit of the discussion, the paper, that was the structure of the paper, looking at employment numbers, trying to establish how this workforce has an incredibly confusing tracking mechanism to track it, but yet it plays an incredibly vital role and an important role in the underlying delivery of our healthcare model. So, um,
And, and didn't you say, Ian, that you really felt like WSIB made it very easy to find the numbers
oh,
for the personal support workers? Yeah.
and it does, but the WSIB doesn't use the same classifications to define the PSW. So the WSIB doesn't call PSWs PSWs. You're called Assistance in Support of Health Services. Okay, so that's what it's called. Now, when you're hired, for example, by an employer, you're hired as a personal support worker. But when you become injured, or if you have a WSIB clearance, you're no longer tracked as a PSW. You instantly become an assistant in support of health services, technically. So let's go into but why that matters, and let's talk. The part of the plot thing we want to talk about is really the post-COVID uh, um, impact that the has this profession gotten better since the COVID?
No,
Better?
no,
No.
no. It's gotten way, way, way worse.
Yeah.
And the part that blew my mind was the number. Was the number. So from 2020 to, and I'm showing my screen here to my TikTok people briefly, but the number of PSWs that were injured was 45,772 claims of workplace injury, dwarfing out every other occupation during that time. So from 2020 to 2024, 45,772 personal support workers put in claims with WSIB for injury. and work time lost.
Yeah.
And the crazy part is that everyone, and I'm not downplaying the police or firefighters. My God, they're extremely important people, extremely important role in our societies and our communities. They keep us safe. They're very, very important. But just to give an idea about everyone is always like, that's a scary job. They're always in danger. Yes, they are. Absolutely. But they only had 3,077 claims in the same time frame. So in 4 years, the PSWs had 45,772 claims of injury and work time lost, and police and firefighters combined had 3,077.
Yes, that's correct. Yeah, based on the reporting numbers. Now, there are obviously the population for PSWs is larger, but regardless, even if you're looking at dangerous, when you're looking at the rates are higher. I think it was 11.7% at the height, which meant 11% of PSWs, or sorry, occupations in support of health services, PSWs, had a risk of running injury at 11%.
11% risk of injury.
11%. And that's why it was so like, okay, so how do you do the comparison? Which is why I had to go the way I did with the comparison.
Well, and this is the interesting part, guys, how where Ian could find comparable numbers. And it was even shocking to us here at OPSWA where he found these numbers because the numbers were found where, Ian, in comparable.
Well, we found the numbers that were listed between 1939 and 1945. So that was the last time that the Canadian population suffered injury rates to a sector of population and during that time. Now, between 1939 and 1945, Canada was participating in the Second World War as per obligations with our treaties with England. So we sent, for those who don't know history, we've sent a lot of soldiers overseas. We did lose a lot. This is a high death rate. But the injury rates were only 20% higher than what our rates in Ontario were for our PSWs for the same period of time. Um, I mean,
Longer, because it was 2020 to 2024 for us. It was 1939 to 1945.
that's right. That's 7 years. But yeah, there was that. Yeah. So yes, that is correct. Yes, it would have been a
Yeah.
longer. So yes, it's condensed, and this is a national. Now, the percentages of those injuries, of course, back in the 1930s, it was greater than the population. But however, we're looking
Yes.
at one province that is unaware effectively that this injury rate exists, even though it does aware of it. There's no, at this moment now, we're trying to bring it to the attention of the population that this is the most dangerous job in healthcare. There's the greatest risk of injury. And the other part of this is that I think we want to talk about is what does this mean for the patients? Like if all these injuries are happening in the event all around the bedside of the patient, Miranda, what do you think? Like that's where my head keeps going.
Well, I mean, number one, I worry about PSW first and foremost. I hate to say it. Obviously, I care about the patient,
Of
but the
course.
PSW, like the amount, I was floored. I did not expect these numbers. I know Ian, you went back and forth on these numbers for over a week because we couldn't believe that these numbers were as high as they are. They've been verified by numerous people that these are the numbers of injuries, and then I think these are the only ones that were claimed.
And
Because
this represents,
and yeah, these are the only ones that are claimed. A lot of PSWs don't do WSIB claims because they're a pain in the butt. Let's be honest. WSIB is a pain to deal with. And a lot of PSWs don't want to. So the real number, God knows what the real number actually is. But then you're right, Ian. What about the patient? What about the people that the PSWs are caring for every single day? These injuries are happening around them simultaneously while they're trying to receive the care.
well, yeah.
It's
So the PSW
scary.
gets well, is if the PSW is getting injured in a move and drops the patient,
Yeah.
then the patient's injured. But if the patient's, I've already had this, it's like if they're already in the hospital bed and they're already injured, the instinct societally is, well, they're already sick, so leave them there. It kind
Yeah.
of is. But going back to the numbers, though, I think this is not just an anomaly that we're looking at because do you have that other because what we're also showed is how much more dangerous this and how much more injury rates have increased since COVID. So since we became an essential workforce in COVID, we've borne the brunt of this. So when we did our first report on this, the PSW workforce had a 700% likely more risk of being injured. Well, that number's gone up to 3,000
Yeah.
over police and firefighters. So we're talking about we've really downplayed a lot of our societal responsibility and our risk onto this work group at the expense of everything. And it's not a zero sum game. There's no reason why these numbers have to be this high.
No, there's absolutely no
There's not.
reason why these numbers have to be this high. But I mean, and we can talk about all the reasons why they are this high. And we talk about it a lot here on PSW podcast, and maybe not in every single segment that we do, but this has been coming up a lot more lately where we're talking about, PSWs get punched, they get bit. I mean, I was reading because we released our press release yesterday about this paper, which by the way, guys, this paper is available on our website, right on the front page. You just scroll down a bit, you can see the entire paper. And we were talking, like, we put it out there, the PSWs were talking underneath this. And the amount of PSWs, there's three of them that said they had knives held to their throats. There was PSWs that said that, they were sexually assaulted. There's PSWs that said, but and these things, everyone, it's like it happens. I get angry, I get flustered, therefore I cannot talk. But it happens, and employers, they they brush it under the rug.
Well, it's
No, it's expected. You're dealing with people with dementia. Yes, I understand that. You're dealing with people with mental health. Yes, we understand that. You're dealing with people with all these things. Yes, we understand that.
absolutely.
But there's got to be a way to do this more safely so that not only does the PSW not get hurt, but neither does the patient. Like, we really have to stop looking at this, like we've said time and time again, Ian. This is not normal. And especially with numbers this high of injury rates, like, we PSWs are viewed as the the bedside nursing. We're the
Yep.
ones that do all the care for the individuals at the bedside. We're responsible for their physical, their mental, their emotional, their everything state. That's what the
Yep.
PSW is responsible for. And again, it's going back to that whole concept, and I'm probably repeating exactly what I said before, which I know I am. Anybody can do this job.
No, that's not true at all.
That's not true. Not just anybody can do this job. And I'll tell you, as a PSW myself, I'm proudly in my 20th year as a PSW. I have injuries from when I worked as a personal support worker. And why
How
was I injured, Ian? Because we were working short staffed, and the person that I was working with did not know how to do a proper two-person lift.
there you go. And that injury, you have no repercussions since that injury. You're now completely fine.
Oh
Did
yeah, totally fine. Yeah, as I
never
see a
had
chiropractor
no
all the
impact on
time,
your life,
and I
right?
have
Yeah. So
massive inflammation from it, and I'm in constant pain. But yeah, no, I have no issues from it. And this guy's is going back 15 years ago.
look at this. We have 45,000 injuries. Okay. Regardless, okay, they could be back spasms, they could have knife cuts, they could be
Yeah,
anything. Each
yeah.
of those injuries requires a sustained support going long term. There is an impact we all have to pay. It seems more and more that the institutions that employ PSWs, and a lot of these are going to be foundational institutions, long-term care, and some retirement homes, depends on those who are registered with WSIB. Um, but at the end of the day, the system is really dependent on that replaceable cheap labor that can be injured and then just shunted away and then a new group brought in. It's a war zone.
Disgusting.
It's a
It's
war zone.
dis it's a
And
war zone.
it's a war zone. And this would be like if you put a soldier on the front line of the World War II and said, the moment, okay, you guys are a soldier. Ladies and gentlemen, as soon as you go up, you're fighting. If you get a victory, you're a soldier. If you get injured, the moment the bullet hits you, regardless where, you are no longer classified as a soldier. On paper, you're classified as a war attendant. Okay? And then if you look at a war attendant, is that has a whole other classification, and then you're just moved. Now, that means you're no longer a soldier. So what value? So the army says we have 0% soldier injuries. Because none of our soldiers get injured in battle. None.
No,
Because once they get injured, they're classified as something different.
well, the war attendants have it real bad. But the soldiers are doing great.
Soldiers are doing great. So this is how you see the how the illusion of the system is being upheld. And this is why you have lots of celebrations of opening new facilities, and you're wondering, are these things to be celebrated?
Long-term care in the scheme of things, if you look at it on paper, and the whole, mantra, mission, vision is spectacular. It's a wonderful concept, but no one's taking these injuries into consideration. And not only physical injuries, let's talk about that for a second. We're also dealing with massive mental health issues
So
amongst our
much.
frontline personal support workers. And I'm going to tell everyone here a little story. And I'm going to out this MPP right now a little bit. because I can. So we met with MPP Buma, nice guy. He actually created a bill for first
That's right.
responders in
This was
Ontario.
cited in the paper, by the way. This is the
Yeah,
very
which is this is cited
this
in the
is
paper.
disclosed.
Not his name. I
No,
said
but
his name.
this no.
But I mean, nice guy. I like him. But
On
anyways, we met with him, and guys, I'm talking this is 72 hours. Okay, so keep that in mind, the 72-hour mark. We met with Mr. Buma, MPP Buma. He at the time, and I think he still is parliamentary assistant to the premier. We
record.
talked to him about the bill. We said we really believe that PSWs, and this is before COVID. We really think that PSWs need to be placed under the bill for first responders to obtain the free supports for PTSD that all the first responders get.
Yes,
What did he say, Ian?
he said no.
Exactly. He said PSWs are unregulated, PSWs are not first responders, and 72 hours later, what happened?
Well, he said we weren't essential services, and it was more of a casual element of the workforce.
Yep.
And it wasn't.
He said
There's,
it's not important. We don't have anything to measure this. We
and
don't we
even
don't
like
know.
the cabinet didn't feel that PSWs were an important element of society at that point.
Well, 72 hours later, we were deemed
Well,
essential
we
and we
found that
became the, what's that?
we found that surprising because we were working with the federal level. A lot of the COVID mandates that were starting to come out there. So going to Queens Park, and they were completely
It
unaware.
was totally different. It was
It was like they're
completely
like they're like
different.
COVID, and we're like, yeah, this thing that's coming down the line, you're going to hear about it in 12 hours. I remember
Oh
having
no, just wash
it
your
was like
hands, Ian.
just
Just
watch.
wash your hands. Just wash
Yeah.
your hands.
But anyway,
You
that being
know,
said, we
yeah,
still became essential services, and we were important. But where's the frontline responder correspondence? Like we don't have any.
no,
We're not considered frontline responders. That's ridiculous.
no,
So
and it's sad. It's really sad, Ian. It's sad that like because we've seen it through COVID. We saw it through COVID. We've seen it since COVID. How PSWs have struggled with their mental health. They've struggled with physical ailments, injury. We were front and center for a very long time. We were the COVID warriors, don't you know? We were the heroes on the front line, and then all of a sudden, we're nothing.
yeah, well, yeah, we forgot about that pretty quick.
We forgot about PSWs pretty quick. And that's really sad because the PSWs are still out there. They are still the front line. They are, and I like to call them the front line
Well,
because
yeah,
the PSWs come that typically when you go into long-term care, home care, retirement, who do you see first that comes into your room? It's the personal support worker. Nurses are frontline, doctors are frontline. The personal support worker is the front line of Ontario healthcare. And at the end, who's the one who leaves the last is typically the personal support worker. And that needs to be recognized and that needs to be defined more. And we really need to look at this group of predominantly women and not to take away from the male PSWs because you guys do one hell of a job. And I admire each and every one of you for what you do. Um,
absolutely.
but we're kind of expected to take it. And that's a very old school mind
Oh, yeah.
frame. Very much so like 50s, 40s,
It's
30s.
paternalist. It's
Yeah.
literally a paternalist point of view. Um, Women are conditioned to provide care, so it's expected. If there's injured people, you put a couple of women in that room, they'll eventually just start providing care. That's literally how people think. Am I wrong though?
Yeah. Yeah. You're not wrong at all,
I'm not. Like
actually.
that's the assumption of our society. They'll just
No.
provide. We cannot build our system on that. One thing I want to talk about is there a comment that we need to go on?
Yeah, someone just said here we need more male PSWs. I said, yep. And this person said, what about the caregiver that is at home 24/7 looking after a family member? Yes, that is a caregiver,
That's a
Kenzo.
caregiver. Okay,
That's a
yeah,
caregiver, which is actually separate from the personal support worker completely. So a caregiver is someone who stays home and cares for their loved ones. And, kudos to you. That's a hard job. It's extremely hard. But the PSW is someone who is formally trained and being paid to perform their duties. And yeah, there's a massive difference between the two of them.
and just before we going back to the military comparison there. So I mean, the military comparison seems rather people like that's kind of hysterical. But I mean, we did have the military come in during COVID to support the long-term care facilities. And
Mhm.
at the end of that, what was the military's request, the soldier's request. Do you remember?
No. Oh, danger pay.
They wanted danger pay because this was dangerous job. This was above and beyond the role of a normal soldier was danger pay. So here at the OPSWA, we've always, argued, compensation is based on education levels. If you want more money, you need to become an RPN. If you want to be more money from an RPN, you become an RN doctor, whatever. But at the end of the day, if there is actually a danger element that does not reflect in the education, if no one else, if this is the most dangerous job, then we really should be looking at danger pay.
Absolutely.
I really think this is something that we should be looking for the PSW.
Oh,
And
and we will be.
well, look at it retroactively too. I mean, this is danger going back to 2022. And yes, the $3 an hour for the COVID was very specific for that care. But if we're talking about general exposure, reducing risk, and you want to protect that workforce and actually put some value behind the people that you're talking about, but most importantly, danger pay would show the real costs of the system that we're actually currently investing in. And right now, the system is currently being subsidized by a lot of factors that you're not seeing. For example, the cheap labor of the PSW.
Yep.
It's not sustainable.
Nope. And I think PSW should have danger pay, and that will be something
Absolutely.
that the association will be moving forward on asking the government for danger pay for personal support workers based on the numbers that we have collected from WSIB to show that it is the most dangerous job in healthcare.
So we will
Plain and
have to be
simple.
meeting. So hopefully Premier Ford will be willing to meet with the association in the near future and we can discuss this. We'll see. Um, that being said, one other thing I want to tie in there because I made a promise. A huge part of this is the risk of injury. For those of you who are working and you have WSIB, please look at getting additional insurance coverage. This is not a commercial for insurance. Please look at our website. For those who are members, there is additional insurance coverage because, like Miranda's saying, these are long-term injuries. You're on your own. The government doesn't want to track you for what you do. Your employers don't want to consider you PSWs because they track you as something differently. So please look at the association for some investigating these tools. We do work with Moments of Truth. That's what Andy promised you a shout out. But back to that, danger pay.
You know
Yeah.
what? It was this whole it's been hard keeping these numbers. I've been trying to launch this for 2 weeks. And Ian kept stalling me because there was more and more that had to be done on there. And then Ian got sick with the flu, and finally he's good
Still
enough to
am.
come back today. Um, yeah, it's
So
yeah, it's
what can we do? Right.
what can we do? Number one, I think personal support workers have to be cognizant of the fact that this is a dangerous job, and thank you for being that person and being those individuals that do this job because it is vital, it is essential, and not just anyone can do it. And not just and not everyone gets injured either. But we're seeing rather high rates in the injury. So we need you to be cognizant of it, take the extra training, get yourself the really cheap insurance that the association's partner has. It's like $7 a month, guys, just to make sure that you're okay and that you have backup in case something happens. And leave it up to the association because we will be targeting the Ontario government for danger pay for personal support workers retroactive to 2020 because this is ridiculous that you guys have to work under these situations. Your employers are aware of this. That's the part that pisses me off the most.
Oh,
The employers are aware of it. Supervisors are aware of it. Why the hell are we not doing more about this? These are individuals. It's the vulnerable taking care of the vulnerable. And we're just letting
maybe
anything happen.
again, it's an embedded prejudice I think we have in our society, and it's all Western society. This is traditionally cheap labor, and that's how we see it. And
Well,
it's not gonna it can't last like this.
let's change it. And PSWs, stand up for yourselves and really fight for yourselves. Because at the end of the day, as an association, we do our best and we try our best to, fight for you guys at any level here in Ontario. However, your voice is the most important factor because your voice not only protects you, but it protects those in your care.
And we really want to make sure, especially that you protect yourselves. Okay, you're going to be pressured to do things that are going to cause injury. The numbers speak for themselves. Okay, you are going to be pressured to do things that are going to cause you injury, even if you know you shouldn't do it. What can we do better as a long-term care in this sector? Say no. This is dangerous. This is dangerous for everyone involved. Okay. We need to take the business out of this, and that's how this is being treated. Like this is a machine.
Yeah, and it's not a machine.
It's
These
not
are
a
human
machine.
beings.
Well, the
Yep.
people are getting clogged and gummed up in the gears,
Yep.
but they keep opening
Yep.
new ones. So
Well, you know what? I mean, we always got to bring things to the forefront. I think this was a really important paper. I hope it takes off more than it is. You guys will see a whole lot about it over the coming weeks that we're going to be posting little snippets here and there. Please, please, please share this. For those of you that are watching us on TikTok, please make sure to follow us on Facebook on Ontario PSW Association or on our Instagram under Ontario PSW Association, because it's important that we share this information, we get it out there, and we talk about it. Because at the end of the day, you guys should not be having this level of injury rates. And no occupation should. This is beyond.
we forgot something.
What's that?
Danger pay, but the more important thing is, and we mentioned this, Bill, we had this conversation yesterday. Working short is the reason why people are getting injured. We need ratios.
Yeah,
These
we
numbers are
absolutely need
demonstration.
ratios.
Sorry.
Yeah,
Danger pay, because if they're not going to have ratios, then danger pay.
yeah.
Okay, it's you can't have it both ways because right now they're
No,
doing. Sorry, I want to jump in. I forgot all about ratios, and it's a
no, and that makes a valid point. And I said that earlier, was it's because we're working short. I was injured on the
yes,
job because we were working short. And
yes.
because the personal support worker also did not know, that they didn't know what to do. Like
Yeah.
it's no one knows what to do. It's anyways, there is a question that says you get hurt by a resident and management asks what can you do to prevent this? Okay, and Lori says the employer blames us if we get injured. Okay, the employer blames you, you throw it the heck back on
We're
them.
back at them. Say
You
what?
throw it back at them and you say, okay, so like that other person said about what could you have done differently? What could you have done to prevent this? We did a whole series on this here on PSW podcast because a PSW 9.9 times out of 10 cannot do anything differently. This is a reaction from someone who has dementia, or it's a reaction from someone who has mental health, or hell, they're just a jerk and there's a reaction.
Yeah,
Okay. And
yeah.
suddenly the PSW gets injured, and then they ask, what could you have done differently?
Well, that's the question we have.
Your fault as the PSW.
Well, we have
No,
these
it's not.
injuries. So let's ask the minute. Okay, well, who would be the minister of long-term care?
Mhm.
What could the minister of long-term care be doing differently? Well, she could be doing something would be good, but
Yeah.
nothing is what the current mandate is. So
Yeah.
the question is, and the question PSWs, every time you get asked that, we have to ask, why does the minister tolerate that?
Yeah.
This is what the minister wants.
Yeah.
Okay.
Yeah. And you
Because
know what? The thing is, the nurses, they think it's great that all this money, and kudos to nurses for getting money for long term care and for more training in long term care. But guys, what she's setting you guys up to do right now is work in long term care to do personal care.
so we should talk. Yeah, long-term care needs danger pay.
You definitely needs
Yeah.
danger pay. The
So we are.
PSWs, guys, throw it back at your employer
And
because
if you get injured, sorry, I don't mean to jump in, but if you get injured and your employer is telling you what could you do better, and you're the victim, no. We got to come up with a mechanism now where this becomes reported to like another network, a bunch of different ministries, because we need to end the siloing in healthcare, including how these things are reported.
amen. I agree. I agree. Great questions, great conversation. I love it. And again, I think this is going to be a topic that we continuously talk about over the course of the next few months because this is the truth. The public deserves to know the truth, and the PSWs deserve to have their truth be told. That's what the biggest thing for me is bringing that truth to the forefront and talking about that gray area that nobody wants to talk about because God forbid we talk about what's actually happening in Ontario's long-term care homes, retirement homes, and home care sectors. God forbid.
And if you're a PSW and you want more information, your MPP would be a fountain of resources. Just go contact them, set up a meeting, ask them what their opinions, and we can ask our MPPs and your constituents, what can we be doing better as a community? It's an excellent question, and I think we absolutely should take the mantle.
I think we absolutely should. I'm seeing a campaign forming in my head as we speak. All
What can we
right.
do better?
What can communities do better to support their personal support workers and most vulnerable?
We need to
That's
be
what we have to
responsible
be.
management.
Yes,
Responsible
absolutely.
management would be the first key. Real leaders. That would be the next.
Real leaders is a key. All right. Thanks so much, everyone, for your questions, for allowing us to go off and, of course, have our therapy with you every Friday where we talk about the issues in the PSW world. It's a lot to soak in. If you guys want to view this paper and read it for yourself, it's not very long, but you can see all the information in it. It's located on our website at www.opswa.ca. If you scroll down a bit, you'll see it right there. It's called the Ontario Personal Support Worker Post-COVID. What is it? Wounded in Chaos.
Chaos. We went,
So go have, because it is Wounded in Chaos.
well, it is
So
chaos.
amen. That's all it is in the PSW world currently. So thanks so much, everyone, for joining us. Remember, I will be on TikTok Live tonight at 7:30 to do our OPSWA After Dark. So I'm happy to have the conversations with you guys tonight as well on TikTok Live about this paper and about what the association is planning to do. Thanks very much for joining us. If you're not a member yet, make sure to either head over to our profile on Facebook or on TikTok. Click the link. It's all self-explanatory from there. Make sure you are protected, because if you're not an OPSWA member, you are not protected. So make sure you get on that and have yourselves a wonderful Family Day weekend. The offices will be closed on Monday, but we will be returning on Tuesday as usual. And we'll be back next Friday with yet again another PSW podcast. Thanks so much for joining us, everyone. Have a wonderful Family Day weekend. And with that, we're going to say, OPSWA out.